So you're saying I'm accepted as one of your own. All right, so today what I want to do is kind of plan out the rest of the semester with you guys. So April 11th, that is next Monday, right? If you would have chapter 8 read by then. On April 13th, chapter 9. This is both in the Allen vaccine book. Easter break happens, so that means that the 15th and 18th there is no class. April 20th, we tentatively have Dr. Reagan Skelton coming to give a talk. She is the new biology hire. She is going to be talking about vaccines development as it pertains to the flu vaccines and the flu in general, since that's kind of what she did her PhD work on. On April 22nd, I would like you to have read part 3 of Immune. And yes, I realize that's a lot of stuff. We'll come back to that in a second. April 25th, we have another speaker. This is Nurse Heidi Gubani. If you know Joe Gubani, this is his wife, or Marcus Gubani, this is his mother. She is an expert in public health, and she plans on talking about vaccines as a public health measure. April 27th, then, chapter 10 and the epilogue. And then April 29th, part 4 of Immune, which is a shorter section than the other one. Then we have our final exam. What day is our final exam? Anybody know? I don't know. Someday, Wednesday or Monday. Monday? Okay, so for the final exam, I want you to have read all of Rachel's Autism. No, I'm kidding. I'm not sure what we're going to do with Rachel's Autism or the final exam. I've got decisions to make with that. It's possible that Rachel's Autism will just be something that you guys read over the summer when you guys are bored. Alternatively, that's probably what will happen. Alternatively, I could see doing something where instead of a final exam, you do a reflection over the book. But I haven't made that decision yet. How would you feel about either of those two options? Either not reading it or reading it and reflecting on it. You like reflections more than tests? Yeah, time is an issue. So, what? When are you going to read it? Yeah. What? What if we just did a reflection? On your lives? Yeah. We're going to do a reflection, so bring a mirror. Yeah, so final exam, I will let you know more about that. Probably just be a normal final exam, kind of like the midterm was. The paper, I think I have a due date for that. 20th? No. 2 weeks. 2027.
Wait, Matt, what do you think it is?
Before the end of the semester.
So like the 29th?
Just as long as you hand it. If you're graduating, is anybody in here graduating? I don't think so. As long as you get it into me before you leave, because I think we have to have grades in by Monday after graduation. So as long as you get the paper into me before you leave to go home or before graduation. Legitimately. You can turn it in your rough draft later than Friday. Because I honestly don't know that would actually help me out with having time to read them and get comments back to you. So, Anne's over there. I worked so hard on getting that done early. Questions? Okay, there is one other thing that I want to talk about, and that's with these two speakers. I will be having lunch with them prior to this class. Are you guys interested in also having lunch with the speakers? Are you not? Are you available? I'm not going to make it a required thing. This is a Wednesday, and this is a Monday. It's fine either way. I just kind of need to know whether you guys want to or don't want to. And you don't all have to do it. Just if you could let me know by Friday whether you want to have lunch with them or not. So by next class period. And you can do one or not and not the other. It's fine. Whatever you want to do. I think that I'm allowed to invite you guys to lunch. I just need to check with Dr. Hink. It would probably be in the cafeteria, so it's not anything special.
What time would that be like after this class?
It'd be before, from 11:30 to 12:30. Do you have class or what?
I do have class before this, but it's one that if I wanted to go,
Yeah, if you really wanted to go, I bet we could get you permission. If there's a class that interferes with it.
It's a gen ed class, but so many people say that I feel bad. I'm always there. I will never not be there.
But it would be an excused absence, so it wouldn't just be skipping.
Yeah, that's what I'm saying. It would be fine. Yeah, when you see the Zoom hall, people are so I have to be there for it.
All right. Does this seem like a reasonable schedule to you guys? As a part of this, the last quiz was your last quiz of the semester. And the last homework was your last homework of the semester. I will still be making Anki things, but because you have plenty of reading to do, I don't want you guys to worry about doing anything besides the reading and writing the paper. Are you guys upset about that?
No.
Okay. All right. Expecting you guys to come out with pitchforks now. I really like those quizzes. Becca is like, yeah, I actually did. I like quizzes. And Anne's that way too. I don't know why I pick on you. I'm sorry. I know why I pick on her. I don't know why I pick on you. All right, so it's been a while. What were we talking when we last left off about? Okay, DTP roulette, the DTP vaccine, and really kind of the beginning of the modern anti-vaccine movement, although there could be an argument that Andrew Wakefield's publication was more of the beginning of the modern anti-vaccine movement. I don't know, you guys probably don't consider the 1980s modern, but I do, because that's when I was born. 1984, if you're wondering. Something has changed between the 1940s, 50s, 60s, and now, and that was that the social good of vaccination was no longer automatically accepted as a social good. Why do you think that was? Why were vaccines no longer just, hey, these are for the good of society, this is something that we should partake in as a society? I mean, there was anti-vaccine movements before this, but as a whole, they were mostly accepted, especially in the early 1900s, as being a benefit to society in most cases.
The early middle 1900s, you got wars going on, and vaccinations for the military is influencing the public perception.
Okay. So I wouldn't say this is exactly an argument from authority, but an argument from military or something, which military generally is respected as a someone that's out to do good for the country and not to harm them, and if they were willing to vaccinate. So that's a reasonable thought. Any other thoughts?
There's a lot more like legal action taken against them, just like with the roulette and everything, like in the 80s compared to like when they were just more like a new thing.
I would agree with that. I would say that that was more of a cause than an effect of this, though. What had vaccines successfully done? Okay, so they were really starting to be victims of their own success. Ultimately, because vaccination was working, the diseases weren't as prevalent and weren't as severe as what they used to be, and therefore was not necessarily seen as something that was as bad as a vaccine, which could sometimes have adverse effects. So one of the diseases that was being controlled that is a part of the DPT vaccine is pertussis, or whooping cough. This is caused by the bacterium Bordetella pertussis. Two S's there. Bordetella pertussis, the reason it caused disease was really due to the pertussis toxin that it produced. So it caused disease because it was a bacteria that tried to, survive in your body, but the negative effects that led to whooping cough were typically caused by the pertussis toxin. This toxin had the capability of crippling your white blood cells, so it decreased your immunity, and would also damage cilia, such that you find in your lungs, so that you had coughing problems. The actual whooping cough infection generally would be something that your body would take care of fairly rapidly. Within a week or two, it could get rid of the infection. But the lasting damage and the continued presence of the toxin was really the negative consequence of this. So in Japan, the whooping cough was actually referred to as the 100-day cough, because the could last up to 3 months, which is not a fun experience. It was called whooping cough because the individuals would cough so hard that they would essentially become oxygen deprived. And then once they finally were able to catch a breath, the inhalation of air would cause a sound that was described as a whooping sound. And that's why it got its name as whooping cough. The development of the vaccine, so there's really a story of two vaccines here, a whole cell pertussis vaccine and a acellular pertussis vaccine. The whole cell pertussis vaccine was developed in Michigan. Two individuals that had a significant role in this were Pearl Kendrick and Grace Elderling. They ultimately made this vaccine by growing the bacteria and then inactivating it with phenol. So the entire cell was still present because they didn't purify anything for the vaccine. One of the challenges with the pertussis vaccine was actually testing the efficacy and the safety of it, because in lab animals it didn't necessarily produce the same response that it did in humans. And so in addition to developing the vaccine, they also produced ways of testing the efficacy and the safety of the vaccine. But even though they did that, testing of it was still problematic. The tests that they developed weren't really that conclusive of whether the vaccine was safe. Sometimes it could pass the safety test and still cause problems later down the road. So it wasn't, it was still a problematic vaccine. On top of that, manufacturers didn't really see a value on improving the vaccine. There's a couple reasons for this. So the vaccine, although it was problematic in its safety issue, it was very efficacious. It did definitely work. So you had a product out there that worked. Why do anything about it? It was a very cheap vaccine to produce, so it didn't cost a lot of money. It was something like 5 cents per dose or 5 cents per vial to produce. So the vaccine did not break the bank when it came to it. And it was actually hard and expensive to get new vaccines approved. You had to test them for their safety and efficacy. You'd have to prove that they are a better vaccine than these other, than the vaccine that's already out there. And so even though there was some vaccines that got developed at this time that may have actually been improved, ultimately the companies would shelve them because it was too costly to produce them. And so this vaccine, which was somewhat problematic, led it to persist. The acellular vaccine was produced by a couple of individuals by the last name Satos of Japan. They actually worked out this vaccine of removing the cell and purifying the toxin, since that's what was causing most of the problem. Overall, the evidence for this vaccine showed that it had improved less severe reactions. But it was not developed in the United States. It did catch on elsewhere, and it really really took off in Japan, where it was produced. However, there was a little bit of difficulty getting this vaccine into the U.S. and manufacturing it here. We already had a vaccine, There was disagreements about which vaccine was actually better. Although it had less reactions, there is some evidence that it was less efficacious. So this probably, the wholesale one probably produced better immunity, but more side effects, whereas this one had less side effects, but also less immunity compensated for it. So overall, it took a while before the acellular vaccine was used in the United States, and the wholesale pertussis vaccine continued to be used, I think, up until the early 2000s, at least the late 19,000s, even though there is some evidence that it had some severe side effects associated with it. There is controversy in whether the side effects actually are due to the pertussis vaccine or not, but there's probably good evidence that it wasn't the best vaccine out there as far as its safety record goes, even though it was very good at doing this. While this was being developed, the anti-vaccine movement was growing. So Barbara Loe Fisher, she started writing a book called A Shot in the Dark, which ultimately was not only attacking vaccine companies, but was also encouraging other individuals to seek more holistic or naturopathic medicines, alternative medicines that weren't actually all that efficacious. Barbara Loe Fisher and Kathleen Williams, the two of the individuals that helped form Dissatisfied Parents Together, were very much what you might call granola parents now, where they wanted the best for the children, which isn't a bad thing, but saw things that were unnatural as not necessarily being healthy, and would do more naturopathic remedies, didn't trust whole or mainstream medicine, and yeah, those sorts of things. So it wasn't too surprising that they would encourage alternative medicines. Meanwhile, in Congress, Dan Micah, so you might remember the Micahs as individuals in vaccine roulette who were twins that were purportedly damaged due to the DPT vaccine. Dan Micah was a congressman that was kind of featured in this, and so he started to introduce a vaccine compensation bill. This bill was proposed to both help family members as well of individuals who had either been damaged or perceived that they had been damaged by vaccines, as well as vaccine companies by providing a payout such that they didn't necessarily have to go to litigation. For the most part, it was agreed that vaccines were an important public health good, and so they needed to make sure that the vaccine companies stayed in business. All during this time, there was a lot of vaccine companies that would either go out of business or quit making vaccines because they saw vaccines as a huge liability. They weren't super profitable, and the lawsuits that came with them, it oftentimes was cheaper to settle those outside of court, but that was costly too, that it was very hard to make a profit off from them. So the vaccine compensation bill was proposed both to keep vaccine companies in business, because then the government was standardizing payouts for injuries that were vaccine related, and it was also compensating parents that thought that they had been damaged. So it was a quick way of getting compensation. It was considered no fault, so just because they paid out didn't necessarily mean that it was the vaccine company's fault. It was just saying this is sort of a side effect that came along with getting vaccines. Occasionally people will be injured. There was a table of accepted injuries. So For example, if you had convulsions after the DTP vaccine, this was listed under there. You'd get this set amount for that, or you would be paid for life if it ended up being a life long issue that came with it. In the case of so you either got lifetime needs, or in the case of death, there was a lump sum payment of $250,000. It's always hard to put a price tag on life because life is really not something that is something you can trade for money. So it really makes no sense putting a price tag on it, but sometimes you have to do that, and that's what they did here for $250,000. It required the companies to record exactly what lot of the vaccine was being injected into the individuals. That way they could track whether it was a bad lot or something like that along those lines. If it wasn't a part of the accepted injuries list, it had to be proven essentially in court that this injury was more likely to have been caused by an injury than not. So it had to essentially have a lot of evidence for it that it actually caused an injury. But at the time, the list of injuries was pretty robust. There was a lot of things that could have been accepted as that. There was opposition to this. So the Reagan administration at the time didn't really favor the bill, and neither did the regulating companies of the CDC and the FDA. The reasons: the table of compensated injuries was considered by them unscientific. The things that were being compensated hadn't been proven to be caused by the DTP vaccine, so they were awarding things that likely were not due to the DTP vaccine in their opinion. The payments were considered too high by these people. The estimated cost for this was something like $5 billion for previous vaccine injuries, and because there was such a wide range of things that were accepted, it was more likely to pay out than not if you went up against them in court. It basically presumed the vaccines were to blame, which in turn decreased public confidence in those vaccines. If you were automatically saying, hey, this child had a seizure after he got a shot, here's money for this, well, obviously it was the vaccine that did it, and therefore, why would I want to go give my child a shot if I know that there's a chance of getting a seizure? This comes back to the table being unscientific. The seizures hadn't been proven to be a part of this vaccine at this time. And then one of the last arguments was that as the bill was originally written, civil lawsuits could be brought forward. So just because the government said, okay, the vaccine company is not at fault, but we're going to pay you anyway, that doesn't mean that they couldn't take it to civil court and still sue the vaccine company, and the vaccine company then having to pay out again for a civil lawsuit. So that ultimately led to these people having opposition. Ultimately, a vaccine compensation bill was signed in 1986. Reagan felt a lot of pressure to sign it, so he reluctantly passed the bill after it made its way through Congress. This was considered a bipartisan effort. You had individuals both on the Republican and Democratic sides working to get this bill passed. It did go through many revisions, but ultimately the bill that was passed generally was more lenient towards the people that were making the claims than it was to the vaccine manufacturers and companies. So what it led to, initially there was a lot of frivolous lawsuits. The one example the book gave, a woman came in and tried to be compensated for her dog who had gotten the rabies vaccine, and then she thought it was damaged in some way by getting the rabies vaccine. I forget exactly, like it started having behavioral issues or something. Initially, the parents, because it was usually parents coming in for their children after the vaccines, were given the benefit of the doubt. There was probably many payouts that happened, as many as a third of all claims, that were injuries that were most likely not due to the DTP vaccine. And that's not ones that are uncertain, like they probably were not actually due to the DTP vaccine, but because you basically gave the parents the benefit of the doubt, were given the benefit of the doubt. They got the payout regardless. Despite this, the debate over the vaccine continued, and really it went in one and two different directions. So the general public became less keen on the vaccine. They thought that it caused problems, while the scientific experts were more skeptical of injury claims. Why were they more skeptical of injury claims? It wasn't necessarily that. I think they would agree that there were people taking advantage of it, but it was due to epidemiological studies that were coming out. So epidemiological studies of human populations and diseases in them, showed several things. First of all, the severe reactions that coincided with vaccination were extremely rare. We're talking 1 in 100,000 or less would have reactions that were considered severe. Although blamed for SIDS was actually less, I'm going to capitalize that, common in vaccinated children. And seizures were equally likely whether you'd been vaccinated or not. So the evidence really did not show out that there was a strong correlation between vaccination and the development of brain damage or seizures. Likely there was some relationship to it, but it was a very small relationship, and ultimately rare. And there was really three possibilities for how this could be related. So the first possibility, likely true in some cases, but probably very rare, is that the DTP and a reaction to it led to brain damage. A second possibility was that brain damage was going to happen regardless, and really the DTP reaction was a trigger that accelerated an underlying reaction that triggered the brain damage sooner than what it otherwise would have happened. This could be an issue because typically the younger you are when you start having these seizures, the more severe brain damage that could occur. So if it was something, a seizure syndrome, something that happens multiple times, having it triggered sooner would be more detrimental than having it triggered later. But a third possibility that was considered was that there was an underlying issue that would have caused brain damage, but it also caused them to react adversely to the DTP shot. But the DPTP shot had nothing to do with the ultimate brain damage that you got. Sort of like you would have a sore arm when you get vaccinated, and you also, well, that's not a good example. It's basically having issue C causing issues A and B, and there's a relationship there between A and B now, but only because C is related to both of them. Ultimately, it was determined that these three possibilities at the time could not be distinguished against. Therefore, in some situations, it probably was one situation, the first situation. Sometimes it was the second one, sometimes it was the third situation, and it was ultimately difficult to distinguish between them. That resulted in the payouts happening, but as more and more evidence was raised, the DTP injuries began to be removed from the compensation list. All right, questions? I did too much talking today. You guys need questions? All right, no questions, then I'll see you guys on Friday.